They wanted me to try buffalo yogurt in the worst way when I was there, and it's like, I literally will have a reaction, so no.
You don't do dairy?
I don't do dairy, no. Yeah. So, but they really wanted me, like, are you sure? Just not even a little nipple? And I was like, no, I'm good.
Yeah.
I don't think we have any EpiPens around here or anything.
No. Yeah, I always travel with.
Yeah. I don't know if I've never gotten one for that, but like, you know, if it was. Also, the closest hospital
Like
was.
a high chai tea, but usually I'm a coffee drinker.
Completely allergic to
My
everything.
brother moved out, but she says
She
coming
has
as
come
much
through
as white. She's like,
the
oh my gosh, he's gotten a
Those can eat
weight
right
again.
I don't know if you would
I'm
say
so
own country. It's its
Yeah.
own, like, yeah, I guess it's its own country.
Nepal.
Yeah.
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 She's
Has its own king,
That's what I was gonna say, yeah.
its own army.
I don't know.
Yep.
Okay, it's countries.
The
Yeah.
Gorkas?
Gorkas.
Yeah. We saw a lot of them actually training in the
I
mountains.
drink my
I'm
glass.
watching them doing their
Unless it's a
And they were
small
always
can.
running on the road. And then like the dogs would freak out, the street dogs would freak out with the heat up. Then they would camp up in the mountains, the dogs all night long, just. And you're just like, oh, please stop. I'm trying, I have to treat tomorrow. Yeah. I put that little picture up there because I previewed it for Stephanie. She couldn't comment. She was just like, so where is Nepal? I was like, oh God. Let's put a picture on here. Just to
Yeah.
I'm glad you did. Yeah. My brother thought it was in China somewhere. I was like, no. But I've had people who are like, it's in
China's
India. I'm
pretty
like, no,
north
it's
of
not in
India.
India, you know.
Yeah.
It's the sandwich in between, but it's not, you know.
Like that here.
So I'll do mine and then you guys can get up and share your experience. You can show us where you went.
All right.
I started the recording, so.
Oh, okay.
Whenever you're ready.
All righty. Well, hello, everyone. Thank you for coming. I'm very excited to be able to share my experience with my medical service trip to Nepal. As we were kind of just discussing a little bit ago here for the audience that is here, I put a little nice picture on here to show actually where Nepal is. I realized recently that a lot of people don't know where it actually is. So if we're kind of looking here at the map, it's kind of sandwiched in between India and China. It is its own country. Yep. Most things that Nepal is known for is obviously Kathmandu. There's a beautiful song about it. Just kidding. And then Mount Everest is probably the biggest thing that it's known for. So here is the clinic that I was at in Baharabi. This below deck, you'll get more pictures of this and I'll show you the interior, all of that. This is just a good close-up picture so I can kind of show you. This is the clinic all below in here. Up in here is volunteer living quarters where our clinic manager and head acupuncturist live, and then the kitchen and stuff like that back in there. So this is what I kind of want to discuss with you all today. We're going to do just a little introduction to traditional Chinese medicine. If anyone is new here that doesn't know about it, I'll give you just a little brief overrun. And then I'm going to talk obviously about the Acupuncture Relief Project. That is the project that I volunteered with here in Nepal. We'll talk about the Baharabi clinic that I served at, the patient demographics of Nepal, the cases and treatments that I did, and then if you guys have any questions. I'll obviously have a lot of fun pictures and other little things as I go through. I can't show you everything. I have probably over 3,000 pictures for my trip, so fun pictures, that could be a whole different presentation. So just a quick little overview of like what traditional Chinese medicine is. So everyone always associates acupuncture as our big scope of practice, but actually traditional Chinese medicine is a scope of practice within itself. It is its own comprehensive medical healthcare system. So although we are a lot of times called acupuncturists, we have a lot of different modalities underneath our belt in what we go to school for. So here is like our whole scope of practice. Sometimes breath work isn't included. It kind of depends on where you go to school. here I like to think of it as like a little umbrella. Here are some of our bigger main things that we typically use. The little stars in here just kind of represent needle-free options. I think everyone, again, associates acupuncture and needles, but like I said, our modalities are comprehensive and not always just involving needles. Some of the main things I did while I was in at the Baharabi Clinic was obviously acupuncture, Chinese herbal medicine. I did do a little tuina, a lot of maxa. I also did some Easton while I was there, cupping, acupressure. These other things at the bottom, a little bit harder to do, especially with language barrier. And food therapy is a very hard thing because a lot of times food is very cultural and traditional in many different things. Depends on type of season also and what they can grow. So it's really hard to recommend, hey, you should eat this when it doesn't even exist in the country. So. And then I just always like to include some common conditions that traditional Chinese medicine providers see. I know everyone always thinks that acupuncture or the scope of TCM is only for pain. Although it is amazing and great at treating pain, we are, like I said, a whole comprehensive healthcare system. So we treat all different types of conditions and manage a lot of different symptoms that they have. So this is just a quick little overview. So let's kind of get into what the Acupuncture Relief Project is and who I actually went and volunteered for. So the Acupuncture Relief Project was created by Andrew Schwab. He is a DOM, just like myself, a doctor of acupuncture and oriental medicine. He taught for a really long time at OCOM, Oregon College of Oriental Medicine. That's where I went and received my doctorate as well. And he started this project back in 2015 after the major earthquake that has happened. We're going to watch a little video. It kind of explains a little bit. You'll see Andrew and some of the other like key components of people as well. A quick little good video introduction, and you can kind of see what the village may look like, how people work, kind of things like that. I think it's a good realization because it's really hard to depict through pictures and sometimes even explanations. So just keep in mind that Nepal remains one of the world's poorest countries. It is technically classified as a third world country. Most people are making about $244 a year. And people that are in the rural areas, which make up 85% of Nepal's population, sometimes may even make less than that because they are typical farmers. So it depends on that growing season. All right, so let's watch this little video and then I'll continue on. So as you can see, there is multiple little different things in there. You can kind of see how people, their lifestyle, they're working the land a lot. Like when we think about farming here, we think of like equipment and all the things that we have. These people don't have that. They're using their bodies pretty much every single day, especially out in these rural parts of the village. And then as you can see, some of those other locations within that, those are some of the satellite clinics. So when you saw like the tents and things like that, there isn't always a brick and mortar structure. They're usually by like other health posts and stuff. We'll get into kind of more of that stuff too, but I kind of like this video to kind of show you guys a little bit of like, what does the landscape look? What do people look like? What does their work look like? And what is like, you know, the Acupuncture Reliefs Project's main goal? It's just to make sure that people have some type of healthcare, or having people who can, you know, say, hey, I think you need to go to a hospital, or hey, we need to get you on some blood pressure medications and things like that. So yes, we do acupuncture and we help people in many different ways in that, but we're also making sure that people have healthcare just in general. So like he said, you know, how can a community acupuncture help people in these rural villages? Community acupuncture is a very powerful tool and healing modality. So, you know, in these rural areas, like we said, there's not many care provided. So anything where anyone can listen to them and diagnose them, maybe even just check their high blood pressure, their sugar levels, and kind of monitor what's going on for them is very vital and very, very good for them. Obviously, money is very scarce as well. So people not having to go to the hospital if they don't need to is also a big and major resource for them as well. So these models are actually very cost efficient. Another big thing too is acupuncture doesn't rely on the availability of expensive medication. A lot of big thing too is like resources. So someone may need high blood pressure medication. They may need to be treated for tuberculosis or some of these other things. That doesn't mean that when they go to the hospital that there's actually going to be medication there to treat. So some of these things that we kind of take for granted, they don't have there as well. So we can have the diagnosis, but that doesn't mean that we're actually going to have a way to treat them. I think the great thing about the Acupuncture Relief Project is that, you know, even when I saw someone come in with some crazy high blood pressure, we may not have had medication to give them that day, but we still did a treatment and helped relax them and made them feel better, take their pain away in some way. People are never turned away. And I think that's something that's very important, especially in these rural places. So let's talk a little bit about the clinic. So the Vajravi Clinic is the main clinic that ARP has. Like I said, there's a lot of satellite clinics that may happen. At one point, there were 6 different satellite clinics kind of all around in this kind of region here. It depends on whether and what season we're in. I was in the monsoon season, so I primarily was just at this clinic. When it is not, when it's winter, you can travel around to other satellite clinics, do house calls, kind of things like that. Monsoon season makes the roads really horrible, and therefore travel is even worse than it normally is. So therefore, you usually stay in place. And then importantly, like, care is always free for these people. The Baharabi Clinic is located 3 hours about southwest from Kathmandu. So this is Kathmandu. That's the big city that pretty much everyone knows. Actually, we were kind of located right about down in here, but most of the time you can't find a good image for that. So this is kind of where we were treating. It's about 5,500 above sea level in elevation, so we are high up into the mountains. So most times patients are traveling anywhere from 30 minutes to 3 hours just to be seen at the clinic. The nearest hospital from here was Paloon. That is about 45 to 50 minutes if the road conditions are good by car. So walking, that can take anywhere from 2 to 3 hours. So you can imagine it's really hard. And a lot of times, even at the Paloon hospital, they don't even have what they need to treat patients. So a lot of times then they would be shipped off to Kathmandu. And that's where transportation would then need to be arranged. Most of these people struggle with trying to find transportation or to be able to afford it. Also depends on the season. Monsoon, you're not getting there. ERP does about 6,000 to 8,000 TCM treatments annually. Common treatments are musculoskeletal, digestive, hypertension, diabetes, stroke rehabilitation, colds, flus, and surgeries are the big main things they see pretty much on a daily basis. So here is the clinic, another viewpoint of it. This is what you see as you come up the mountain. There's a little cute little pavilion where patients can wait outside, either for us or the health post. This is the health post. If you continue up here, it is located right up into there. This is where people can go and get different types of medications. Maybe they need IVs. They're there to serve as like an in-between before you would go to the hospital. A lot of the times they may not also have what you need. We do a lot of things like vital checkups, ear checks, other things like that before that they would be sent to the health post. And then we also have a lab, which is located right there in that picture. This is if I needed to confirm, fasting glucose. Do you actually have diabetes, or was this a blood pressure, blood glucose check? They also do a lot of other things. And there is a birthing center as well here. So this is where women can have a little bit more, I guess, of a clean environment to have a baby in versus just home where most people do. This is what the clinic looks like in the morning. This is actually was taken back in 2015, but you'll come down in the morning from your headquarters and there'll be just patients waiting outside to be treated in the morning. No one gets turned away. In the peak heavy season, they can see probably 250 to 300 people in a day. If there's not room in the clinic, they just literally set them up outside and just treat them as they go. Obviously, the clinic runs for about 6 days per week. Saturdays, there is no clinic, but within that time frame, people have to be seen. So that's either a 6-hour to sometimes a 5-hour chunk where that amount of people need to be seen. I have a couple little videos. So this is what the inside of the clinic looks like. That was my other volunteer I was with. That's some of our interpreters in the back. So you can see it's usually a chair style, or there's a couple beds if we're doing back treatments where if patients are really elderly and they can't sit the way that we need to. This is kind of what outside, that's the reception area. That is all the patient files and all of the patients that we see. It's a whole spanning, and then that's what's outside. Just some still pictures. So back here is where we keep all of our supplies. Here's our herbal cabinet, all the different modalities, our acupuncture stuff, and then beds. Here is being done as an ear flush on a boy. He had a lot of compounded wax within the ear, so they flushed it out, and then he went to the health post and got some antibiotics. This is something that sits right outside the door before you enter into the clinic. I thought it was just kind of one of those beautiful things that you read and kind of feel really inspired by. So with the idea that the healthcare should be friendly and accessible to all people, this clinic is dedicated to the compassionate and competent care of the patients who we serve. They also do teaching and other things. This is Satya. He is the main acupuncturist that is there. He is actually employed by the Good Health Nepal, which is a governmental program that works with ARP. And here he is showing some different points to the other volunteer that was there. So here are some of just me in action, you can say. Here's me looking lovely, educating a patient, talking to them about their conditions, taking some blood pressures. This is one of my interpreters, and then here I am treating a patient. So let's talk a little bit more about these patient demographics. So typically about 52% are females and 48% are males. That's a pretty good ratio. Here in the US, I typically see more females than males. So this is a pretty kind of cool to see that it was pretty proportional. The main religion within Nepal in this area obviously depends on where you're going. This was Hinduism, but they also have different castes. Castes are basically the different hierarchy and structures. And within each of these 3 to 4 castes within this village, they all have their own different traditions, cultural norms, how they eat, their family living styles. So you can imagine that can be quite complex. Even the way that they speak languages with different dialects can be different. I mean, you could go 5 minutes down the road and someone could speak a different dialect than someone else. So the interpreters really played like a really big role in helping us to understand and communicate with the patients we're trying to tell us. I also thought it was quite interesting that the older generation, people from 70 plus on, don't even speak traditional Nepali of what they speak today. So a lot of the times the interpreters would be like, I think this is what they're saying. I think this is what they're trying to communicate. So very interesting, the dynamics of just how culture and education plays into it as well. So they have a really strong community and generational family living style. So what that means is multiple generations live in one home. Usually if you were born a girl and you married into a family, you then go and live with that family. The son usually inherits the land in the house that is passed down through generations, or if there's multiple sons, they divide in between. And everyone within the community pretty much just loves everyone in the community. I've never seen people who are just so happy and loving and just joyous to be alive. So that was something that obviously is a little bit different than here in America as well. So most of them have an 8th grade education. It's a lot more common today that most of the younger generations, millennials and down, are going to year 12, which would be the end of our high school, and then they do go on to college, usually to Kathmandu. Like I said, that older generation that is like 70 plus, usually typically no education whatsoever. They primarily work every day except religious holidays and festivals. These are some of the most hardworking people I think I've ever met in my life. And again, that's because survival is key, right? And 92% of those patients are farmers. So how you had seen in the video of the guy kind of digging in the dirt and towing, and then them kind of going through and harvesting, that's a daily life thing for them. They primarily eat what they can grow. So when I was there, this is what was mainly in season. So rice, potatoes, squash, okra, chilies, peppers, eggs, roti, masala tea. These are pretty much the staple diet of what they were eating, especially in this region. Although chips, soda, and candy are a lot more common in the markets, and they have seen a lot more high blood pressure and diabetes within the younger generation. And here are just some good pictures. You can see these are up into the mountains. These are some of their fields. And this is a guy just taking his buffalo for a walk and getting them, their food and their little walk for the day. Here are some of the things that I ate while I was there. I was lucky enough to have 3 meals in a day, and I had someone cook my meals. So very fortunate. Typically, a morning breakfast is a roti, which is a bread for them, like a fried tortilla, some type of bean, maybe potato, and if you're lucky, a hard-boiled egg. Other meals consist of rice, potatoes and squash, sometimes a protein. Here's some peas frying. This is more of like a fried rice that they made with eggs. Here's some of those chili peppers and what a market typically looks like. And as you can see, you know, they carry their things on their back with their head like that. Usually it would be filled with grass. As you can see, this other one, they're carrying a load for their animals to be able to feed. This is also a road after a heavy rain. And they're literally just in sandals or just a lot of times barefoot. And this is right outside the clinic. They're taking some of the buffaloes for a walk. Yeah, just a really pretty picture. So while I was there, I did 22 days in the clinic. During that time, I did 260 treatments. These are the things that I saw. I saw pain, so, you know, knees, backs, ribs, hips, anything and everything that you can think of that could have pain, I treated for. Most of these were due to impingements, herniations, bulging discs, stenosis, osteoarthritis, injuries, you know, anything that you can think of, major things probably happened. Headaches, I did stroke management, saw people for gastritis or low appetite, fevers, flus, coughs, sore throats, sinus, acne, depression, dizziness, high blood pressure management, diabetes management. I saw a broken wrist. I saw a snake bite, which was very interesting, really flexed my brain muscle. Cancer symptom management, menstrual issues, and a rash. Here is one of my post-stroke treatments that I was doing. Lower back due to osteoarthritis, scapular pain, neuropathy. So I did a little abbreviation chart. This is mainly for two people who are not here at the presentation today, so that when they're looking through this, they understand what's going on. Here, the kids would come with grandparents because they don't have childcare. You know, the grandparents are the childcare providers, so they would come and watch us do acupuncture. Here are two interpreters in training learning from us as well. So here's my first clinical case for you guys. This one was degenerative knees. This was a 61-year-old female who had been diagnosed by a doctor with bilateral degenerative knee disorders. So this is a really hard thing to treat. This basically means where the knee bones kind of just rub right together, and it's a very not comfortable sensation. Most of these people have knee surgeries. This is not something that can happen very frequently within Nepal. You would have to go to Kathmandu. It's an expensive surgery. It requires healing time, which a lot of people don't have. Plus, there is the stigma of not wanting surgery overall. So a lot of times people will just suffer and kind of deal with pain. So her main complaint was obviously continuous knee pain for 4+ years. She described the pain as deep and achy with a grinding sensation. That's where those bones are kind of just rubbing together. The location of pain was behind the kneecap, so that's the patella. It got worse when she would walk down hills, and this whole village is just hills, so you can imagine it was painful all the time. And then it would get worse in cold weather. Her pain scale was about a 7 and an 8 out of 10 with walking, and the knees were at cold to the touch. I have diagnosing and treatment of things in here. This presentation will also serve for another purpose. I have been asked to do this for my master's program as well. So these students are acupuncture students. This can mean absolutely nothing to you, and it doesn't have to mean anything. This will also serve as remembering for me in the future if I have to give this for other presentations and things. This also just gives you a little bit of like how we're diagnosing. We diagnose within TCM principles. So this is a common thing that you may see, a wind, cold B, an underlying kidney essence decline. But we also have the diagnosis of the Western. We already know what that is. That was that degenerative knee disorder. This was my treatment. So these are the acupuncture points that I used. Again, you don't have to know what this is. You have a picture over here of these are some of the points that I was doing. Some other additional things, maybe I would change out an acupuncture point here and there. And then we also did needle moxa or eSIM. So this is needle moxa. It is basically where we put the moxa directly onto the needle and we light it, as you can see the interpreter down here doing. She's lighting it with a match. This helps to warm the needle. It helps to bring warmth to the joints. It helps to tonify, relieve pain, move blood, do all those different kinds of things. So I saw this patient for my whole entire time, actually, while I was in the clinic. She came 2 to 3 times a week for 4 weeks. Her outcome at the end, well, last day before I left, this was her last thing she had told me for pain scale. So she was reduced to a 2 out of 3 out of 10. Yep. And she only had pain, she said, when she was walking down the hill. So she had some mild achy sensation. She had less grinding sensation. Still there. I can't fix bone on bone action, but you know, at least she had less pain. No sensation of cold within the joints anymore. And she said she was thrilled. She said she could do her farm work and she had to take less breaks. So that was a pretty good positive review. Here's another one. This was a left ankle pain injury. This was a 38-year-old male. He had some acute pain. About a week ago, he had fallen at a temple. And on this side of the ankle is where he was kind of having pain. He said it was like sharp with any basic movements. At night, it would hurt worse, or if he moved the ankle at all. His pain was about a 5 out of 6. And the ankle itself was like warm to the touch, and he was a little bit like swollen in there too. Pretty classic for when you have an injured ankle. Again, my diagnosing the treatments that I do doesn't have to matter to you guys. But we also did some direct needle mox. So this is really good for moving blood and getting circulation to the area so that the ankle can heal faster, especially in an acute situation. We also did some trauma liniment on the area afterwards. Liniments are basically either alcohol or a glycerin base with herbs decocted into it. It is then applied to the skin externally. The patient was sought for 4 treatments in a week. His outcome was 0 out of 10 pain when he was done. He had full range of motion, no sensation of warmth. He said he was back to his normal self. His ankle was good. And I never saw him again. This is my flu and fever case. She was an 84-year-old woman with flu symptoms and a fever of 102.3 when she entered into the clinic that day. She had also taken Tylenol that morning, and she had broken down and went to the one pharmacy and had some Tylenol, so it could have been possibly higher. She had cough with production of phlegm, stomach pain, and low appetite, fever, body aches, fatigue, dizziness, insomnia. You know, all the really good flu type feeling. She said her fever made her feel warm, sweaty, and it was really hard for her to sleep and rest, and she felt just generally unwell. At night, eating and movement made all of these things worse, and she was warm to the touch. She was pale, and she visibly did not look good. She was pale and fatigued, and she came in kind of hunched over and just well looking. Again, here's some of my diagnosis. Here's some of the points that we did. I also gave this woman an herbal formula. The first one that I did was Jing Chun Wan. You guys, again, don't have to know what any of that means. This was her first treatment that I gave to. The pattern changes as we go through with colds and flus, so I gave her a second formula the second time she saw me. Over here is the little bag that we put the medications in. This is how we tell them how many pills to take, because most of them do not know how to read or write numbers. So we just have to you count out this many circles, and that's what you take. And then either, if they were eating 4 hours. So this patient came and saw me for 2 treatments within 3 days. Like I said, after the first one, she had reduction of fever, cough, body aches, no more phlegm, and she had some increase in her appetite, which is good. After her second one, she had some minor dry cough with no phlegm, no more fever. She was back to a normal temperature, mild stomach pain. The patient's complexion was no longer pale, and she was walking without a hunch, and she actually was able to speak, and it was not a whisper. So, and then she continued to come and see me for back pain. And this was my patient who had fractured her wrist. She was 46-year-old. She was out farming one day, and she had fallen down a hill, and she had did a type 1 fracture on the radius As you can kind of see up in here, for those who don't know, this is what it is. It's just kind of like a little like hairline there. And this is the radius in here. She had it on her palmar side. So palmar side is like, if you think about the palm of your hand, that's the where it was fractured. So when I first saw her, she had come in a sling. She had the sling on for 4 weeks. She also had a cast. She had that. So the first week that I saw her, we didn't get to do direct work to her arm because she had that cast on, but I treated opposite side. Then the next week she got it taken off, and then we started to really do this work with her arm. She obviously had pain and weakness on that left side. She described it as deep and aching, and then when she would move, she would have like that sharp zapping type sensation, and she had a weakening grip as well. Obviously, it got worse with movements, gripping. She's also farming and feeding animals, so she never gave her arm a rest at all. Her pain scale with rest was about a 3 out of 10. With movement, it jumped up to about a 7 out of 10. The arm itself was cold to the touch, and you could tell that she had visible muscle loss within that arm. Obviously, she wasn't using it when it was in the cast. But to be able to gain back that strength, we really need to try to help reverse some of that atrophy that she had as well. Again, here is my diagnosis, some of the points that I did. We also did some pole moxa on her with the needles, and then we did some tiger warmer. I'll show you that in the video. And then again, she did some trauma liniment as well. She was really keen on trying to get better, so she actually asked me for what should she be doing at home, so I gave her some little things to do. She would massage her arm every night. She would do mustard seed oil on it. She would heat pack, which is basically she would put her arm over a fire. And then I told her to please rest and rest and rest. And I don't know if that one really happened. So this is me performing the tiger warmer. So basically, moxa is put into this metal contraption. Moxa, if you guys don't know, is usually an herb that is lit. It's rolled into a stick-like form. It creates heat, and the specific herbs helps with different properties and things like that as well. It's called ivy. Again, you don't really need to know it. I just like to educate. This stick is put into that warmer, and then we warm it across certain channels and things like that on the arm. It's very hot. It can get very hot, so that's why I used a little scarf over her as well, so I wouldn't burn her. This is something fun that we usually don't get to do in America, so it was a really cool thing for me. I saw this patient for 2 to 3 times a week for 3 weeks. Her pain scale at the end reduced to about a 1 out of 2 out of 10 with movement. She had no pain at rest. She improved a little bit of grip strength. She could do her chores a little bit better. She could actually cut grass again, she told me, which is very important for their animals. And then she had no sensation of cold in the arm anymore. So she was still obviously a work in progress when I left. This is my last one. I try to give you guys like not just pain related case, so like some of my more interesting ones. Also tried to take pictures as I went along, but as you're really busy, you forget to do things. So this is my 82-year-old female who came in for knee pain, but also left ankle rash. She got this after being in water. I don't know any other context, but she just kept telling me she was in water and the rash appeared. The rash itself was dry, scaly on this left ankle, as you can see. I don't have like a really great, there was an even better picture of this. This was like her first, this is like her second, and then I didn't really get her end one because I was busy. But it did kind of reduce to kind of like right in there. So those edges all really kind of came off. It was shrinking as I left. Again, here's some points, some things like that. I saw this patient about 2 to 3 times a week for 4 weeks again. She was coming in for knee pain as well, so it wasn't just the rash. The cool thing about this is we call this surrounding the dragon. It's basically an area where we needle in specific distance around a specific area. So we do this sometimes with rashes or different types of skin things, bruising, scar tissue, other things like that as well. And when I was done, she had no itching and burning. which before was like a 9 out of 10. It drove her like absolutely nuts where she couldn't even sleep at night. It decreased by about a half to 3/4 of an inch all the way around, which was pretty great. And she had less scaling and peeling. And she said she was happy. She had no more itching, and the rash was shrinking, so she was very pleased. And her knees felt great too, but I already did a knee case, so we didn't need to do that as well. Here are some of my bigger cases that I needed to refer out, were like those anomalies that we're trying to catch. My patient who came in with 200 out of 120 blood pressure, that should be almost like someone stroking out. That is a very severe thing. She was just sitting in a chair, totally fine, told me she had no symptoms. It was kind of wild to me. So obviously I referred her immediately to the health post to get high blood pressure medication. She was then referred on to Pauloon, to the hospital. She did discover that she had AFib and some other type of things that were happening in the heart. I saw only slight paperwork. Some was in Nepali, some was in English, hard to read sometimes. But she also was put on statins and other high blood pressure medications, some cholesterol medications. When she came back the next time I saw her, her blood pressure dropped down to 180 over 100. Still not great by any means, but at least we were making progress, and that was only within 24 hours. And she was coming in for leg pain that day, so I also treated her leg, but she was not concerned about her blood pressure, but I was. And then I had another patient who was coming in who always had blood sugars of 371 to 430. That's insane. She had diabetes, you know. So she was referred out actually to a doctor. They didn't have the medication she needed at the health post, so she went to Pauloon as well. We had been tracking some of her blood sugars for a while, and last time she went, they told her, "Oh no, you're fine, just change your diet." So we kind of referred her on out, gave her some things so that hopefully she would be taken more seriously. She did end up getting metformin, and then she did actually have to go on some insulin because her sugars were so high. And then my other big one was I was seeing a blood cancer patient as well while I was there. He was around, I think, 30 now. When he was 25, they discovered a brain tumor, and then it metastasized, basically spread into blood cancer. He is trying to be managed through an oral medication right now. And they said that if he had any like lung issues, that he needed to be monitored and things like that. So he came in with a dry cough, and he was having some pretty severe diarrhea as well. Those are big like indications something is not right, or maybe he needs to go to the doctor. So I treated him for some things, but then I had to refer him out. So I did all his vital signs, and he had a little fluid in the lungs, so he immediately had to go. We gave him a little referral as well. Here are just some other treatments that I did, cool pictures. This person had some really bad tingling, burning in the hands, neuropathy. This is another one of my stroke patients, a really bad tingling, neuropathy, burning in the feet and toes. I was seeing this lady for headaches and migraines, and really just like a lot of tension within the upper back. This again, this is the same lady. Sometimes I would treat her like this, and sometimes I did not have space, so this is how we would have to treat her. And this was done to help with dizziness that a patient was having in fatigue. So I just want to say, I could give you a little brief overview. There's so much more, but I didn't want to overwhelm you guys, and I think probably might have in some ways. But I just wanted to say thank you for all of those who did donate. A lot of you are in the room today. I hope that you got to see a little bit of the difference that you made in these people's lives, and how appreciative they are. I mean, I can't even tell you how many times they told me how appreciative and thankful that they were there, and that they were able to have care and treatment and just have someone listen to them. So really, it's a huge, huge thank you. And thank you for, I guess, allowing me, Western Wisconsin Health, allowing me to be able to go and leave for a month and do this. I feel like it was very soul enriching. It reminded me of why I got into the practice of traditional Chinese medicine, inspired me in how ways that I can help my patients back here. So yeah, it will be something I'll never forget for the rest of my life. This is our crew. I guess I'll explain to you a little bit. This is Satya, and this is Shashila. This is our clinic manager, and this is our main acupuncture. They are married, and this is their little girl, Avia. We lived all together, me and then the other volunteer. This is Dee Dee. I never got her real name. Dee Dee is basically like they call her big sister. She cooked all of our wonderful meals. This is our other Dee Dee who cleaned the clinic and did all their housework around. This is a big privilege that we had. No one else has this in the village. These are her Sushila, Satya, Sanita, Sushila, and Amrita were our 3 interpreters. They rotated through. Like I said, some of them knew specific dialects more than others, so sometimes they would have to rotate out with whoever we were treating. And then these were 2 interpreters in training. He was an interpreter in training, and this was my other volunteer that I was with, who was from Australia. And this was their little farewell for me. I thought this was kind of cute. So this is one of my patients that I was treating as well. She had really bad, like, lower back, hip, radiation, numbness, burning into the groin. It was a whole complex of mess. I've seen her in my entire time. Here's her doing a little celebration for me, honoring me, blessing me, and basically just thanking me for everything that I did. It was a really special and beautiful moment, so I figured I'd share it with you guys.
Did you put the tika?
Yes. And then this was a dairy-free cake that the people made for me. I thought it was very sweet, very nice. Some farewell wishes. And this is another one of my patients that I saw quite frequently, who was a hoot and a half. She sang for us, she danced for us. She told us that the purpose of life is to have the beautiful loved ones around you and to make the most of it and to go with the flow. She taught me a lot about just being happy and living with what you got. So that is my little presentation of what I did. I could tell you 90 million stories more, but you don't need to hear it. If you guys have any questions, I'm more than happy to answer them now. We can go back to other slides. Obviously, people who are listening to this or seeing the recording, you're more than welcome to reach out to me as well and ask questions.
What was her name?
I do not know her name. We didn't know most of our patients' names.